Hi, my name is Biko. I'm one of the emergency doctors at the Queensway Carleton Hospital. I'll be giving you a little bit of an update on the new ED tracker that's going to come live in October. The Web ED is a new application that allows physicians to follow patients along their visit in the ER. There are several aspects of the new Web ED. First is viewing the data for the current and past visits for the patient, documenting on the patient visit, creating orders for the patients, and discharging the patient. The best place to see this in action is through the new and improved tracker that has changed from our old one. The tracker allows you to get a pulse of the emergency department. It shows you where patients are in the department and to see their course through their visit. The tracker also has all the info we used to have, but now it can do even more. The top navigation bar has tabs that are helpful to access different parts of the tracker. The Return tab allows you to return to your last tracker. The Home tab allows consultants to access other platforms such as WebAcute. ER docs will probably not be using this a lot. The Tracker tab allows us to get back to the main tracker page and other trackers that are available to us. The Chart tab allows you to access the patient documentation. But remember that nurses are also documenting electronically in the Emerge now, so you'll also use this tab to access the nursing documentation. The Document tab is where you'll go to chart on your patient. Within this tab, there are multiple document templates that you can pick from suited to your patient's chief complaint. Also note that on the right lower quadrant, there's a dragon icon if you decide to dictate on the patient chart. The Order tab is where you would go to order labs or medications or IVs for your patient. Remember that this is only going to be active in the second go live that we have at the Queensway Carleton. Between our first and second go live, we will be in a hybrid system where you will search for your patient's charts and document on the computers, but order on paper. The Discharge tab is to work on patient discharge, meaning all the patient prescriptions, work notes, referrals, consultant notes will be located here. The Sign tab allows you to finish off your unsigned off charts, orders, and deficiencies. The Menu tab allows you to create preferences to the tracker. The Gear tab allows you to document issues within the system. The Suspend tab closes your session. The second navigation bar starts off with the hamburger icon. Within the hamburger icon, there are two interesting functionalities. One is called the call-in functionality, where you can create a temporary chart on patients that may be sent in from the community. And then the call-out functionality, which would allow you to document management of patients' abnormal labs or DI once they've left the department. You will also see a tab for QCH. As there are other CHAP hospitals using the tracker, you can actually jump to them if you have privileges at those hospitals. There's also a search functionality, so if you want to find a specific patient. The third navigation bar is where the trackers sit. You can change the priority of the trackers using the More Tracker list. You can also change the priority of the patients in that tracker using the chevron. The rest of the tracker page is divided into two. The left side gives you an up-to-date data on the patient details, length of stay, location, that sort of information, while on the right side you get the patient's resulted labs and DI orders that have been ordered, completed, and occasionally read by the radiologist. The color highlights different aspects of this workflow. What I've shown you so far is just the basic review of the tracker page. Of course, there are more complex workflows that need to be considered, such as how do two physicians document, how will scribes document, how will the handover of patients occur at the end of your shift. There are also opportunities on how to improve our workflow, how to document faster, quicker, how to insert pre-populated data, how to dictate better using the nuanced software, how to set up Meditech to personalize your experience, and where to find specific order sets. All these issues are going to be discussed in further videos and during your training when you start this new electronic documentation. Thank you for looking at this first video of the WebED at the Queensway Carleton Hospital.